Sorbitol metabolism and clinical significance. An alternative way of trapping glucose inside cells is by converting it to its alcohol counterpart, sorbitol, through the enzyme aldose reductase. Some tissues can then convert sorbitol to fructose using the enzyme sorbitol dehydrogenase. However, tissues with insufficient sorbitol dehydrogenase activity are at risk of intracellular accumulation of sorbitol, which causes osmotic damage. This mechanism explains complications such as cataracts, retinopathy, and peripheral neuropathy seen in chronic hyperglycemia and diabetes mellitus. High blood levels of galactose also lead to conversion into galactitol, another osmotically active compound, via aldose reductase, which similarly causes osmotic cellular injury. The liver, ovaries, and seminal vesicles contain both aldose reductase and sorbitol dehydrogenase, allowing them to metabolize and clear sorbitol effectively. In contrast, the lens of the eye primarily has aldose reductase only, while the retina, kidneys, and Schwann cells also contain only aldose reductase. These tissues can be remembered using the acronym LARCs: lens, retina, kidneys, Schwann cells. Because they lack sorbitol dehydrogenase, they're vulnerable to sorbitol accumulation and osmotic damage. Lactase deficiency and lactose intolerance. Lactase deficiency results in dietary lactose intolerance due to insufficient levels of the enzyme lactase, which is normally located on the intestinal brush border. Lactase hydrolyzes lactose from milk and dairy products into glucose and galactose for absorption. There are three forms. Primary lactase deficiency is age-dependent, occurring after childhood due to absence of the lactase persistence allele. It is most common among individuals of Asian, African, and Native American descent. Secondary lactase deficiency occurs due to loss of the intestinal brush border from conditions such as gastroenteritis, for example, rotavirus infection, or autoimmune diseases. Congenital lactase deficiency is very rare and results from a defective gene. Diagnosis includes the lactose hydrogen breath test, which shows increased hydrogen content due to fermentation of undigested lactose by colonic bacteria. Stool analysis shows decreased pH. On intestinal biopsy, the mucosa appears normal in hereditary lactose intolerance. Clinical findings include bloating, abdominal cramps, flatulence due to bacterial fermentation of lactose-producing gas, and osmotic diarrhea due to undigested lactose retaining water in the lumen. Treatment is dietary avoidance of lactose-containing foods, the use of lactase enzyme supplementation, or consumption of lactose-free milk. Amino acids, classification, and key features. Proteins are composed exclusively of alpha symbol, amino acids. Amino acids can be classified as essential, glucogenic, ketogenic, acidic, or basic. Essential amino acids must be obtained from the diet. A helpful mnemonic is PVT-TAM-HAL, which stand for phenylalanine, valine, tryptophan, threonine, isoleucine, methionine, histidine, leucine, and lysine. Glucogenic amino acids include methionine, histidine, and valine. A memory aid is "We met his Valentine, who is so sweet," glucogenic. Glucogenic and ketogenic amino acids include isoleucine, phenylalanine, threonine, and tryptophan. Ketogenic amino acids include only leucine and lysine. These are the only purely ketogenic amino acids. Acidic amino acids include aspartic acid and glutamic acid. These are negatively charged at physiologic pH. Basic amino acids include histidine, lysine, and arginine. Arginine is the most basic. Histidine has no net charge at physiologic pH. Arginine and histidine are especially required during growth. Arginine and lysine are abundant in histones, which bind negatively charged DNA. A mnemonic is his lists, lies, are basic.